Hello, Ottawa parents and guardians, students. We are living in challenging times. I know many families are stressed by having to make decisions about school without all the information they would like. I'm also sure that many parents, children, youth, and teachers are excited about getting back to learning together. The start to the school will be different this year because many people are working hard to keep COVID-19 virus out of schools. I know the more you are doing your part to avoid picking up the virus in the community will help schools a lot. For my family, we made the decision to send our children back to school in person after considering the relatively low levels of virus in the community, the health status of our boys and their close contacts, and how available my partner and I would be if they were to stay at home. We decided as a family that sending our children back to school was the best decision for us, but each family is different, and Ottawa Public Health is here to support all families and address your questions. We've been receiving many questions from parents and students, and I'd like to address some of them here in this video. Questions such as, should my child be tested before going to school? What will happen if there's someone in the school who tests positive for COVID-19? What will it mean for my family, my child? Will my child have to be tested? What are some tips to navigate the return to school? Where can I get more information? These are really important concerns, and so let me try to address your questions one at a time. First of all, do students, teachers, and staff need to be tested before returning to school? No. Students, teachers, staff don't need to be tested before returning to school. The only reason to have your child or yourself tested is if they are showing symptoms of COVID-19 or if they've been in close contact with someone who is tested positive for COVID-19 or if a health official advises testing. A full list of symptoms for COVID-19 is on our webpage, and this webpage is particularly useful, constantly updated, ottawapublichealth.ca/schools COVID-19. I've heard from residents that a negative test result makes them feel like they're free of the virus, good to go, but it is important to remember that a test result's only good for that moment that it's taken. It tells you about that point in time. It can't really give you proof that you're not carrying the virus into the future. So the tests do work best when someone has symptoms, and there really are not many reasons for people with no symptoms to be tested, unless public health or your healthcare provider advises it. Another question, what happens if a student or a staff person tests positive for COVID-19? First of all, no one will be blamed for testing positive for COVID-19. For most people as well, this illness will be mild. Many people cannot identify where they came into contact with the virus because people do not always seem sick when they may be infectious to others. So in the first scenario, if someone in a school setting tests positive for COVID-19 and your child is a close contact, an Ottawa Public Health nurse will contact you directly with information on how and when and if to get tested for COVID-19. As well as any other further actions to take. In the second scenario, if someone in the school tests positive and your child is not considered a close contact, you do not need to have your child tested or keep them home. So I often get asked, what is a close contact? And each situation can be a little different, but a close contact is typically someone who's had prolonged exposure in close proximity to a person diagnosed with COVID-19. So passing someone in the hallway would not be considered a close contact, but spending hours or days together at a home, a workplace, or a school setting would probably be considered a close contact. Again, a public health nurse will be in touch with you if this is the case. What steps do I need to take if my child becomes ill with symptoms of COVID-19? You must keep your child home from school and notify the school that your child is ill with symptoms that are consistent with COVID-19. You will be contacted by a public health nurse who will provide you with directions regarding testing and next steps. What steps do I need to take if my child then tests positive for COVID-19? I can understand that this may be a difficult time, and if you get this result, one of our public health nurses will provide guidance to you if your child tests positive. Certainly your child must self-isolate at home, and it would be until they've completed at least 14 days of isolation from when their symptoms began or when they receive a positive test result if they've never had any symptoms of COVID-19. So it's important to note that if your child is diagnosed with COVID-19, All their household contacts will also require close follow-up by public health, and further guidance will be provided to them as well. What happens when there are people in the school that test positive for COVID? Well, once someone in a school is confirmed with COVID, whether that's a staff person or a student, Ottawa Public Health will reach out to the parents of close contacts to let them know and to help them with the next steps, which could include the staying home, the monitoring for symptoms, and presenting for testing when it's appropriate. Ottawa Public Health would continue to investigate to determine any other close contacts and monitor the situation to determine if there is an outbreak situation, whether it affects a single classroom, a section of the school, the entire school, people on the bus, and will determine when an outbreak can be declared over. So as the start of school approaches, we encourage you to have a few conversations in your family, with your child or your youth, to talk about the following do's and don'ts to help them and their friends stay healthy. Do. Stay at home when you're sick, even if the symptoms are mild. Staying home prevents spreading your illness to friends and teachers. Tell someone right away if you don't feel well in the school environment. Practice no-touch greetings with your friends and teachers at school, and let's share a wave, for example, and not our germs. Cover your coughs and sneezes with a tissue or your upper arm, not your hands, and then throw that tissue in the garbage and wash your hands right away. Bring your own water bottle from home and stay hydrated throughout the day. Don't share it with your friends. Keep 1 to 2 meters or 3 to 6 feet apart to keep you and the friends around you healthy. Wear a mask if you're able. This is required in grades 4 and up. Reach out for help if you need it. It's okay not to feel okay. Talk to your school guidance counselor or check out our website for some of our mental wellness supports. Make sure your immunizations are all up to date. And don't share personal belongings and food with students and staff. Don't share your mask. Don't touch your face. We can easily spread germs from our hands to our mask or our face. I encourage you to visit our new website for parents who have children going back to school. You can find it again at ottawapublichealth.ca/schools-COVID-19. The website includes school reopening plans, health promotion and disease prevention measures, mental wellness supports, partner resources, and much more, including a very helpful decision-making screening tool. Ottawa Public Health has developed this simple-to-use screening tool to help parents decide whether each day their child should be going to school. Ottawa Public Health will continue the conversations with schools, parents, children, and youth. We're going to be monitoring what's happening in schools, and we'll reevaluate and share new information as it becomes available. We're in this together. Thank you. Merci. Miigwech.